How long do surgically created dimples last?
Cheek dimple surgery, also called dimpleplasty, has continued to be a growing area of interest for people who come to my practice specifically for this procedure from throughout the United States and occasionally from outside our country. This is due probably in part to my own initiative many years ago to improve the surgery, which had not been updated for decades since the first publication of a technique in the medical literature. A common concern for people in having cheek dimples is in the longevity of the dimple placement. I'll discuss how I perform dimpleplasty for my patients and the factors that affect the longevity of surgically created dimples. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in the New York City and Long Island area for over 25 years. Much of my practice is focused on addressing facial aging, such as cosmetic eyelid surgery, facelift surgery, skin rejuvenation with lasers, and PRP, as well as filler treatments. I also developed trichostem hair regeneration, which is now established over 10 years as a major advance in the non-surgical treatment of male and female pattern hair loss. As mentioned earlier, I also became known for dimple surgery and have been featured in the media for this procedure. Naturally occurring dimples are the result of a defect in a muscle called the buccinator muscle, which results in a cheek indentation when the muscle contracts. This indentation or dimple is visible with certain types of facial movements, particularly when you smile. So what do I do for someone who wants to have dimple surgery? The first thing I do is to take some measurements and determine by feel where a dimple, if it were to exist as if you were born with dimples, would be placed naturally. I have the patient smile while indenting the cheeks to simulate the potential appearance of the dimples. If the patient is happy with the estimated location of the dimple and acknowledges understanding the risks and benefits of the procedure, we go ahead and move forward with performing the surgery. I always explain that natural dimples can be asymmetric in terms of location and depth. I also reserve the option to use my judgment if there is any potential for any injury to a critical local structure such as a large blood vessel or a salivary duct during surgery. Generally, I perform this procedure from the inside of the cheek and I create a connection between the buccinator muscle and the cheek skin. This results in a dimpling of the skin and is expected to be visible even when you're not smiling for several months afterwards. There is the possibility in some situation that there can be a dimple present without smiling even after 1 year. This can be the situation in some older people with very, very thin skin. Another important point is if you change your mind later on or you have dimple regret, that this is a procedure which cannot always be undone. That is to say that releasing the connection which was made during surgery may not be enough to fully restore your preoperative appearance. The longevity of the dimple is most affected by the patient's skin thickness and elasticity. The term skin thickness is in the context includes the amount of fat under the skin. This means that facial weight gain can result in the dimples being obscured or the connection made during surgery can be stretched and weakened to the point that the dimple cannot be seen. Generally, if a dimple is present and looks good 6 months after surgery, it's a good sign for long-term stability. The longevity is also affected by the age you are when you have your dimpleplasty. If you think about it, facial aging affects the cheekbone projection and the layers of fat under the skin and the thickness of the skin. If the dimple becomes less visible, another dimpleplasty surgery can be considered in addition to other facial aging procedures such as filler placement. The top 3 reasons people have stated that they want dimples are as follows. Number 1, they had a sibling or siblings who had dimples who, when they were growing up, got a disproportionate amount of attention. Number 2, they feel a dimple or dimples make their face look slimmer or more angular. And number 3, they love the way dimples look on a specific celebrity or several celebrities. In fact, I have numerous medical colleagues who perform all aspects of cosmetic surgery who actually refer their patients who request dimples to me. My explanation for this is that although dimpleplasty looks like it should be simple and straightforward, in reality, dimpleplasty is a surprisingly complex procedure to perform with predictable, consistent accuracy. It's important for you to be confident in your decision and in who you select to perform your dimpleplasty surgery. I hope you found this information helpful. Thank you for your question.